So good evening, everyone. My name is Dawn Davin from the IAOP, and I'd like to extend a very warm welcome to you on this first IAOP webinar of the autumn schedule. So tonight's webinar is focusing specifically on the Expert Task Force Phase 1 recommendations on prescription extension. And the purpose of tonight's webinar is to provide signposting to supports and information regarding legislative changes as they relate to prescription extension. As you are aware, IAOP hosted a webinar in February last on the expansion of the role of the pharmacist and what was coming in 2024. We received a lot of feedback at the time requesting further webinars of similar format, and we are delighted to have over 1,000 registrants for this webinar this evening. So to accommodate the large number of registrants, we've had to change our Zoom license. As you may noticed, a slight change in functionality insofar as cameras and mics and the chat box have had to be disabled. However, you may still submit your questions and comments to us using the Q&A function, and we really would encourage you to do so for our panel Q&A later in the webinar. We may use some anonymized information in this webinar also. So briefly, by way of background, in response to recommendation 1 of the Expert Task Force to support the expansion of the role of pharmacy, IAOP procured through open tender a suite of resources to sit within the IAOP Resource Hub for Pharmacists. Dr. Matthew Lynch, Dr. Aisling O'Leary, and Claire O'Neill, a project team from the RCSI School of Pharmacy and Biomolecular Sciences, who I'm going to refer to as the project team for brevity going forward, successfully tendered and subsequently developed these resources. So obviously we know that the Expert Task Force published their final report in recent weeks, but tonight this webinar will focus on Phase 1 recommendations only. So I'll just, Audrey, if I could ask you to go on to the next slide, please. Moving forward. So
sorry, Dawn, bear with me there.
You're okay. No, take your time. No problem. So without further ado, I'm delighted to introduce our panelists tonight. So we have Dr. Matthew Lynch, a lecturer in pharmacy practice, Dr. Aisling O'Leary, senior lecturer, and Claire O'Neill, a Boots teacher practitioner all from the School of Pharmacy and Biomolecular Sciences and RCSI. So Matthew, I'll hand over to you, please.
Thank you, Dawn, for that introduction, and welcome to everybody joining this evening. Aisling, Claire and I are very grateful to you all for joining us this evening, and we're mindful that you're taking time out of your evening after a busy day in the pharmacy, so thank you for that. It's good educational practice to identify some learning outcomes at the start of any session, and it keeps everything on track by setting out what's going to be covered. Our undergrad students here in RCSI are quite assessment focused, and they'll often ask whether or not there'll be a question on a particular practice, outline resources available to support prescription extension, and finally, pharmacist is underpinned by your expert knowledge and understanding of their health needs, which is gained through you delivering dedicated and tailored pharmaceutical care to them as they attend to your pharmacy. During the pandemic, you maintained an unbroken presence in your communities. While it became more difficult for citizens to access other healthcare professionals, pharmacists kept their doors open and continued to provide the same high standard of care. while observing the public health precautions that were needed at the time to keep themselves, their colleagues, and patients safe. So it's against this background of professional expertise, service, and commitment to the highest standards of patient health and well-being that the Minister for Health established the expert task force to support expansion of the role of pharmacy back in July of 2023. And the remit of the task force was to identify and support the delivery of specific objectives, which would then serve to align services and practices that can be delivered by pharmacists and pharmacies with the needs of the health service and patients. And there were two phases identified to the work of the task force. Phase one was around empowering pharmacists to extend prescriptions, while phase two was empowering pharmacists to prescribe within their scope of practice. As some of you will know, the task force has just published its report from phase two on pharmacist prescribing. But tonight, the focus is on the phase one report from November 2023, where the task force's main recommendation was that the legal validity of prescriptions should be extended to a maximum of 12 months. And then to this end, pharmacists should be given the authority to extend prescriptions up to a maximum period of 12 months duration. So continuing in terms of background to prescription extension, back in February of this year, prescription extension was given effect in amendments to statutory instruments that already regulate many of the day-to-day professional activities of a community pharmacist. These amendment regulations are shown here. They're the Medicinal Products Prescription and Control Supply Amendment number 2 regulations from 2024, together with the regulation of retail pharmacy businesses amendment regulations from 2024. In the Prescription and Control of Supply Amendment regulations, the focus was on amending Regulation 7, which addresses the dispensing of prescriptions. It was amendments to this Regulation 7 back in April 2020 that ensured that pharmacists were able to maintain medicine supply to their patients during the pandemic. In the amendment to the Regulation of Retail Pharmacy Businesses regulations, the focus has been on Regulation 9, which, as you know, provides for the review of medicines, therapy, and counselling of patients and the supply of medicinal products on foot of a prescription. And the provisions of Regulation 9, as were originally introduced in 2008, closely mirrored the provisions of Clause 9 in the contract to provide pharmacy services. The practical effect of both of these amendments is that in a matter of days now, from the 1st of September, pharmacists will be able to extend the validity of a 6-month prescription for a further period of up to 6 months. Any prescriptions that have been issued prior to the 1st of March 2024 continue to be valid for 9 months from the date that they were issued on. However, these prescriptions are not eligible for extension beyond the expiry of that 9-month period. So, just a short consideration of how prescription extension builds on your existing practice and experience. So earlier I referred to your knowledge, your expertise, and your experience as frontline healthcare practitioners and how you're recognized and trusted by your patients. So giving pharmacists the power to extend prescriptions may be viewed as the natural progression of the pharmaceutical care that you currently provide within your existing scope of practice. So what do I mean by this? Well, as I've already mentioned, Regulation 9 of Regulation of Retail Pharmacy Businesses regulations has been expanded to provide for prescription extension. A pharmacist reviewing the pharmaceutical and therapeutic appropriateness of what has been prescribed for the patient and counselling them on its safe and effective use of those medicines under Regulation 9 has been an integral and a routine part of your professional practice since it was introduced originally. This review will form an integral part of the shared decision-making that you will undertake with your patient to decide whether or not to extend their prescription. And this is something that I'll explore shortly further. Also, under those original prescription control of supply regulations, for medicinal products that have been listed in Schedule 1 Part B, so S1B medicines, where a prescriber hasn't specified any directions for repeats on the prescriptions, pharmacists have always been authorized to repeat that prescription if they consider it appropriate. And you have always exercised this professional discretion and made a decision to repeat such medicines where you feel that it is safe and appropriate and in the best interest of your patients to do so. And again, previously I mentioned how pharmacists maintained unbroken patient access to their professional services during the pandemic. When a series of emergency regulatory amendments were introduced in April 2020, you seamlessly changed your practice so that patients continue to have uninterrupted access to their medications, even when the number of occasions when their prescription could be dispensed had been reached, where you felt it was appropriate and necessary for the continued treatment of the patient. Pharmacists on that occasion stepped up to the plate, and over the course of the pandemic ensured patients across the country continued to have access to their medicines in a safe and a timely manner. Aisling and I published a research paper at the time where we considered the various emergency regulatory changes that had been introduced on foot of the pandemic, and we made the case for their retention once the emergency of the pandemic had passed. In its report recommending prescription extension, the task force highlighted our recommendation from the paper, which noted it is important that regulatory changes which acknowledge the professional competency of the pharmacist and their capacity to effectively discharge their professional discretion as appropriate in the interest of their patients are retained and further expanded so as to maximize their contribution to the delivery of healthcare and improving patient outcomes. So in terms of, just to summarize, what we're essentially looking at there is you have considerable experience in looking at pharmaceutical and therapeutic appropriateness of a prescription under Regulation 9. You've experience in exercising your discretion in terms of repeating S1B medicines if there were no specific directions on a prescription to repeat it. And finally, during the pandemic, you exercised your ability to ensure the patients continued to have their medicines provided to them, even though the number of occasions when that prescription could be dispensed had already been reached. So it's building on that background that you come into prescription extension. The introduction of prescription extension represents an extension to your scope of practice. However, the introduction of change in whatever form can cause us some uncertainty. What's involved, how we meant to implement this. And already there's quite a bit to get up to speed with. We've had new regulation change, we've had new practice guidance, and there's various other resources emerging addressing prescription extension from various different sources. Aisling, Claire, and I are very cognizant that your day-to-day practice as a community pharmacist is already very, very busy. So when we set about our work for developing a toolkit to support you with this expansion of your scope of practice to allow for prescription extension, our focus was on trying to make it as straightforward as possible, both in terms of accessing it and your ability to consult with it on the hoof, so to speak, as required in the workplace, in the pharmacy. In designing it, we wanted it to reflect, but also to complement your existing knowledge and experience and expertise as a practicing pharmacist, and also to reflect the fact that no additional training is required to be undertaken in order for you to provide prescription extension. In also our work in putting this together, we also drew on our network of practicing colleagues to sense check the approach that we were adopting and to ensure that it was both practical and fit for purpose. So the toolkit that we have put together consists of a prescription extension decision-making tool, and also then supporting references underpinning that, but also other resources that you can access. And also then sample case scenarios. And the toolkit is accessible on the IOP's website as part of its prescription extension sources hub. So tonight we're going to be focusing primarily on the decision-making tool, but just a quick point in relation to the sample case scenarios. If you get a chance to have a look at these and you're beginning to considering whether these scenarios or indeed any real life 6-month prescription that you have in your pharmacy, whether or not it might be suitable for extension or not, just perhaps bear in mind that the decision to extend a prescription or not is informed by the particular circumstances that present at the time for you as the individual pharmacist and the patient concerned. So a decision to extend any prescription and for what period of time will be made on a case-by-case basis as determined by you, the individual pharmacist, in dialogue with your patient or their representative. Therefore, there can be no definitive expected outcome in terms of extending or not extending any prescription in circumstances other than where a prescription is ineligible to be extended. So the decision-making tool, the tool that we have put together contains 6 steps, which you may use to guide your dialogue with your patient, or as is permitted under the regulations, the patient's representative, to decide whether it is safe and proper patient care and in their best interest to extend their prescription in accordance with the law and relevant PSI guidelines. The 6 steps take account of the regulatory requirements as set out in 2 pieces of regulation that I mentioned earlier, but also the recently published PSI guidance, which now has added prescription review to medical therapy review and counselling guidelines. And that guidance is available on the PSI's website. If a decision is made to extend a prescription, then there is one additional step, post-extension follow-up care, which will address subsequent dispensings of a prescription that has been extended. So these are the 6 steps in the decision-making tool. So step 1, is the prescription eligible to be lawfully extended? Then step 2, does the prescription continue to be pharmaceutically and therapeutically appropriate? Step 3, does the patient have a continuing need or chronic conditions that support the extension of the prescription? So, looking at step number 1, is the prescription eligible to be lawfully extended? This may appear obvious, but the first thing that you need to establish is whether or not you can lawfully extend the prescription or not. And there are various prescription features that would render it ineligible to be extended. So these are as follows. Firstly, do not extend is written by the prescribing practitioner prescription. If the prescriber, the original prescriber, indicates that it is not to be extended on the prescription, then you can't extend it. Secondly, if the prescription is issued for a period of either less than 6 months or greater than 6 months. So the amendments to the regulations have now authorized a prescriber to issue a prescription for up to a maximum period of 12 months. So if a prescriber issues a prescription for 12 months or indeed for 9 months or any period beyond 6 months, then that prescription isn't eligible to be extended. Similarly, if the prescription is issued for a period of less than 6 months for example, 3 months, then similarly that prescription also isn't eligible to be considered for extension. As I mentioned earlier, any prescription that has been issued before the 1st of March of this year isn't also eligible to be extended. A prescription for the following medicinal products is not eligible to be extended. So a controlled drug listed in Schedule 2, 3, or 4 of Misuse of Drugs Regulations 2017 as amended, that is a CD2, 3, or 4 drug, that is not eligible to be CD2, 3, or 4 is not eligible to be extended. Then medicinal products excluded for patient safety or operational or reimbursement issues. And again, this is from the HSE in their pharmacy circulars. So as we approach the 1st of September, the exclusions that have been identified are high-tech medications and HIV pre-exposure prophylaxis are correct. This may be increased, there may be additions to this as we proceed, so it's important to keep an eye on those circulars as they issue from the HSE. Just one point to consider is where a prescription specifies a number of medicinal products and one or more of them are not eligible for prescription extension. So for example, if there was 2 or 3 items or more on a prescription and one of them was a controlled drug, then it's advised to consider whether it would be safe and proper patient care and in the best interest of your patient to extend the prescription for those, say, 3 other items when you can't extend it for the particular controlled drug, and whether or not that's the most appropriate thing to do. And that's, again, a decision that you will make in consultation with your patient. So having gone through that, what happens next? So firstly, eligible. Is your prescription eligible to be extended? Then if the case, then you go on to the next step, which is step 2. However, if at that point it's apparent that the prescription cannot be extended for one of the reasons in the adjoining column here, then you'll go straight down to step 6, where we look at what things to consider then when the prescription cannot be extended. So that's step 1. Moving then to step 2, does the prescription continue to be pharmaceutically and therapeutically appropriate? So, as I previously mentioned, since 2008, you, as part of the dispensing process for any prescription, have been screening it for potential problems that may be associated with the therapy prescribed, including therapeutic duplication, interactions with other medicinal products, including serious interactions with non-prescription medicinal products, herbal products, or foods, incorrect dosage or duration of treatment, allergic reactions, and clinical abuse and or misuse. So having satisfied yourself on step 1 that a prescription is eligible to be extended, this second step then is something that you have been doing on each occasion that you dispensed the prescription since it was issued. So it's something that you're both well experienced and practiced in. In the context of prescription extension, it would be advisable as part of this review under step 2 to consider whether or not there are any signs or symptoms indicative of a possible adverse reaction. And also, are there any antimicrobials on the prescription? Antimicrobials are not excluded from prescription extension. However, it is recommended to take account of the current guidance from the HSE's antimicrobial resistance and infection control team, in particular as it relates to long-term prophylaxis with antimicrobials. So again, what happens next? If you're satisfied as to the continued pharmaceutical and therapeutic appropriateness of the prescription, then you will then go to step 3. However, if at this point something emerges as part of step 2 and you're not satisfied or you're to consider the prescription for extension, then you will go to step 6, where you will and we get to step 6 shortly. I'm going to hand over now to Claire, who's going to continue on with step 3.
Thank you. Good evening, everyone. So step 3, so does the patient have a continuing need or chronic condition that supports the extension of the prescription? So often as community pharmacists, we may not have this information to hand. However, it is quite a straightforward step. Speak to your patient or the representative and clarify what their individual circumstances are, including what is or are their chronic conditions. And the HSE defines a chronic condition or disease as a long-term health condition that needs ongoing treatment and management. And then you clarify, does the patient need to continue to take the medicinal products prescribed? So if you are satisfied that the patient has continuing need or chronic condition, then proceed to step 4. Or if you're not satisfied, proceed to step 6, where you consult that information on what to do if it's not eligible. So step 4. So what is the patient's history with the prescribed medicinal products? So this step is a discussion with the patient about their current health and also a review of their PMR that's available to you in the pharmacy. So for the period that since the prescription was issued, you assess the patient's compliance with the prescribed medicinal products, confirm that the history with the prescribed medicinal products isn't changed, and consider is the patient's condition satisfactorily managed with their current prescribed medicines without the need for any intervention or changes to their therapy. Other issues you might consider would be, are there any monitoring or testing requirements associated with that medication? Has the patient been taking any medication not included on the PMR? Any serious interactions with non-prescription medicinal products or herbal products or food? And when is the patient next due to be reviewed by the prescriber, and consider any upcoming outpatient appointments in a hospital? If you are satisfied that the history with the medication on the prescription is unchanged and that other related issues such as compliance, monitoring and impending appointments are accounted for, then you proceed to step 5. Or if not satisfied, then you'll proceed to step 6 as well. So I'm going to pass over to Aisling.
Okay, so following on from step 4, step 5 turns to assessing whether the decision to extend is in compliance with proper patient care, any requirements described in regulatory guidance, and in the patient's best interest. This really focuses on a self-reflection around the previous active steps 1 to 4, whereby you are satisfied to extend the prescription based on your own expertise, clinical competence, knowledge, and understanding of the patient's condition or their conditions, their prescribed medications, along with any other relevant information that you have gathered during the interaction and dialogue with the patient or their representative. In terms of clinical competence, you all have extensive experience and you know your own patients very well. This is around extending a prescription, building on the experience, as Matthew has said, that you have gained during the pandemic. So acknowledge your strengths and capabilities as much as any limitations you think you might have. Ultimately, you will need to be satisfied that extending the prescription provides safe and proper care, serves the patient's best interests, and concurs with any additional regulatory requirements and PSI guidance. What next then? If satisfied to extend, you can extend the prescription for a period not exceeding 12 months from the date specified on the prescription. You are not tied to extending a prescription for a further 6 months. You can extend it for any period of time, so maybe a month, 2 months, etc., up to the maximum period of 6 months. We'll come back to that in a moment when I talk about the post-extension step. If not satisfied, then the prescription will not be extended. In both cases, you proceed to step 6. So if you are satisfied to extend the prescription, you will continue your dialogue with your patient or their representative, letting them know that you will extend the prescription for a specified period of time, provide them with any relevant detail which informed the decision, any monitoring or follow-up required, and that you will inform the original prescribing practitioner that their prescription has been extended. Naturally, you will then counsel or educate your patients as normal on receipt of their medication. Having extended the prescription, you will now need to record in the patient's PMR, as outlined in regulation, the following details: the date of the decision to extend, your name and PSI registration number, details of the review undertaken, and your decision to extend, and the method, be it telephone, email, used to notify the original prescribing practitioner of the fact that you have extended the prescription. You must at this point also make reasonable efforts to ensure the practitioner who prescribed the medicinal product or products is informed of that decision to extend the prescription within 7 days following this decision. In the event you are not satisfied to extend the prescription, you again continue this engagement with your patient. Advise them that you are not in a position to extend the period of validity of the prescription. Provide them with the relevant detail which informed this decision, including the rationale for it, which at this stage will no doubt have emerged during your interaction with the patient. If a prescription is not eligible for extension for one of the reasons outlined by Matthew earlier, advise them of this. Refer them back to their prescriber, and if required, you will explore emergency supply options with them. The rationale for this decision not to extend must also be recorded in the patient's PMR as per the PSI guidance. After this step, we have a post-extension follow-up care step, if you want to call it that. As I said a moment ago, a 6-month prescription can be extended for a maximum period of another 6 months, but it can be done in, a 1-month period or 2 months, up to that 6-month period. So at each subsequent dispensing of an extended prescription, it must continue to be reviewed in a similar manner as we have just outlined in steps 1 to 6, to assess the ongoing pharmaceutical and therapeutic appropriateness of the prescribed medications. And if following this review, at any subsequent dispensing, you may then conclude that continuing to dispense the prescription does not provide safe and proper care and would not be in the patient's best interests. Accordingly, you may choose not to dispense the prescription. In those circumstances, continue to engage with the patient, to advise them of this, and provide them with all the relevant detail informing this decision, including the rationale for it. Refer the patient back to their prescriber at this point, and, if required, again explore emergency supply options with them. So, having gone through those steps now, you will see that this decision tool essentially describes an in-depth interaction with the patient or their representative with you, the pharmacist. So that communication, that two-way process. Underpinning this, of course, requires you to utilize the core competencies as outlined in the PSI core competency framework. But this is combined with the in-depth knowledge and understanding of your patient's pharmaceutical and therapeutic needs that your practice as a community pharmacist brings. If we look at the personal skills domains, domain 1 of the CCF, they are of particular relevance with its focus on demonstration of leadership, confidence in making sound decisions and solving problems, the need for collaborative working relationships, in this case with your patient, and of utmost importance, the need to communicate effectively. These latter two behaviours of this domain are fundamental to reaching a decision regarding your prescription extension, as the decision will require the patient to be part of that decision. And above all, understand and be in agreement with your decision, the pharmacist's decision, and your rationale for coming to that point. So that brings me neatly, I suppose, in a way, to that concept of shared decision-making. It is traditionally regarded as a collaborative approach between patients and healthcare providers regarding available care options to select a best or the best course of action. This is one definition, but there are several others. Back in 2010, there was a UK white paper published, and it described this patient-centered focus as no decision about me without me. This traditional shared decision-making model has largely occurred in the hospital setting, focusing on available treatments and pathways and to enhance adherence to these. In that setting, this would often or could often occur in circumstances where the parties would not know each other very well. But for prescription extension, you will very likely already know your patients well and be familiar with the process. Pharmacist, they identify the potential for it. Claire will expand on this now in the next slide. It's not a problem per se as defined in this tool, but as described here, but an option to explore an available course of action. This may reveal the level of involvement the patient may or may not want, possibly dependent on their health literacy, and conversely, what the pharmacist may or may not want to pursue. Context is all important to proceed through the steps of the decision-making process. You, of course, must also share your thinking around issues you identify. In terms of exploring options, using the tool as an aid or a guide, options can be identified and the pros and cons elucidated and discussed in this two-way process. At each step, it will be important to explore the patient preferences regarding the extension of the prescription. While the focus may inherently be on medication-related issues pertinent to extension and ongoing patient care, understanding any other motivations that patients might have for you to extend their prescription will also be beneficial. In terms of negotiating the plan, that is, the decision to extend or not, the decision you make should ideally be arrived at mutually. And I think that's fairly apparent now, based on that conversation around those decision tool steps. Indeed, in circumstances where you may decide not to extend, this may be even of greater importance. Extension may not always be possible, and it is important that you communicate as effectively as possible why you're not able to do so. Patients may then, of course, be concerned that they will not be able to get back to their doctor to get a new prescription before their supply of medicines runs out. It is obviously important to alleviate such concerns and consider the provision of an emergency supply. Again, by engaging with your patient and communicating with them throughout, this will help avoid a situation where you cannot extend a prescription and the patient cannot understand why. Once a decision is made, the tool highlights the need to inform the patient and the follow-up requirements. In the context of shared decision-making, this revolves around checking with the patient, or of course their representative. Clarity in the rationale of your decision is important, and that any patient concerns or expectations are addressed. If a decision to extend is undertaken, then provide the opportunity to further discuss as outlined in step 6. I'll now hand you back to Claire for some further considerations.
Thank you. So, having heard all that, I suppose it hopefully you can see that we're trying to streamline the process. And I suppose as a practicing pharmacist, I am familiar with how busy it is in the pharmacy. And adding something else into the mix can be a challenge, especially at this time of year with vaccination season around the corner. So over the next 2 slides, I will identify some considerations about the practicalities of incorporating prescription extension into your practice. Please do remember, these won't be all day, everyday conversations that you're having. Some prescriptions will be easier to review than others, and some may take a little bit more time to review. So the decision-making tool can be used by you to review your cases. As you gain experience with this, you'll be able to run through the 6 questions and it will become a much more streamlined process. For those prescriptions that do require more consideration, you can dip into the further detail behind each question that you might need. I have been trialing the decision-making tool in the pharmacy over the past number of weeks to see how I will use it when it is in practice. As my own confidence has developed with it, I feel it has become a smoother process, and actually I keep relating it back to what I was doing already when reviewing a prescription. And in reality, there's not much more to it. Much of the detail in the 6 steps are something that was happening already, and this is actually a streamlined process. And I'm reassured that when I use the tool, that I will be meeting my obligations that are now set out in that legislation and in the guidelines when I do conduct a consultation in the future. So I've tried to structure the practicalities that we've thought about and what you may need to think about to incorporate prescription extension into your practice. Please remember, as Aisling has mentioned, how you run the service in the pharmacy will have to be communicated to patients. So let's start with who. So who is going to initiate the request for an extension? Will the patient ask for an extension, or will you, the pharmacist, ask the patient if they would like their prescription to be considered for an extension? If it is patient-led, then when speaking to the patient, take account of patient drivers that might be driving that request for the extension. So appointment availability with the prescriber, the financial cost associated with it, work commitments that they have and the lack of time they may have to get to an appointment, etc. If it is pharmacist-led, will you identify the prescriptions on the 6th dispensing? Review the prescription for suitability and then ask the patient if they would like their prescription to be considered for extension next month. Ensure your patients are fully aware of what the review process entails and the process you plan to conduct. A conversation will be required to discuss the patient's history and current circumstances. It is important that the patient understands it may be a case that the prescription cannot be extended or could be extended for 1, 2, 3 months up to 6 months. Those patient expectations, it really is important to manage them. Another who then is who will carry out the review process with patients. So if there are a team of pharmacists working in a pharmacy, are they clear on the processes that have been put in place for prescription extension? Is there effective communication between pharmacists to ensure continuity of care for a patient? Documenting the justification for your decision to extend or not extend is important on the patient's notes to ensure that continuity of care. In terms of governance, the PSI guidance does state that prior to extending the validity of a prescription, you must ensure that a pharmacist reviews the prescription for suitability and appropriateness, considering individualized patient circumstances and having engaged in a conversation with the patient or the representative. So all pharmacists must be aware of the process that is in place. And then where? So where will the review process take place in the pharmacy? Will it be in the consultation room, at the counter, on the phone, a combination maybe? As often happens, patients may phone the pharmacy to request their prescription, and this might result in a prescription extension consultation. Or if a prescription is ordered via an app, then there must be contact details provided by the patient so that you can contact the patient to arrange to conduct a consultation. Wherever it does take place, will you be able to access the information you require when you're conducting a consultation as well? And then I suppose this next bit is around considering how the pharmacy will continue to operate while you're engaged in a prescription extension consultation. So when? So will this be scheduled for appointment or not? If it is scheduled, are you going to do it on set days per week, at particular times on those days? Consider your busy periods. You may or may not wish to schedule review appointments, but for those prescriptions that might take a little bit more consideration, you may ask the patient to call back at a time that suits, or you might take their phone number and conduct the review with them over the phone. And then what? So what are the prescription extension review activities that must be carried out? So we have our administrative details. We have to ensure appropriate details are recorded on the audit note for daily audit printout. We need to record justification for our decisions, the pharmacist's decision on the patient's PMR notes. Notifying the prescriber of the decision to extend must be within 7 days of the first extension of the prescription. Will this be via health mail? You might consider an email template you wish to send. And if you're not extending a prescription, then that 6-month prescription is now out of date and should be filed away for record keeping. And then in terms of staff training, so how will your staff be communicating with your patients about prescription extension? Do your pharmacy technicians, those involved in the dispensing process, know what is required for documentation? And you should consider how documentation on the audit note will be carried out and by whom as well. Do your SOPs require updating to incorporate prescription extension? This is noted in the PSI guidelines as well to support medicines therapy review, counselling and prescription extension. And then professional indemnity. So consult with your professional indemnity insurer to confirm that your policy provides the necessary cover when providing prescription extension service as well. So these are some considerations. You might think of some more for your own pharmacy, but hopefully they'll start, I suppose, help you to start planning for the service in your pharmacy when you choose to do so. So available with the decision tool as part of the toolkit on the IOP website are a range of references and supporting resources. These include this webinar, also a webinar that was on the 21st of February, the expansion of the role of pharmacists, what's coming. The Pharmacy Medicines Legislation Training Programme has been updated to incorporate the prescription extension legislation and is a good reference source, and also the IOP training resources. So they have various online training programs in areas such as diabetes, cardiovascular risk, chronic respiratory illness, polypharmacy, and medication review, to name a few. So if you require further signposting or support, these are resources which can support you in your decision making. The first point of call will be the IOP website, followed by the PSI website. Further signposting to other sites such as the Department of Health and Irish Statute Book are flagged within the toolkit as well. So I'm now going to pass you back to Matthew for some closing remarks.
Thanks, Claire. So just by means of a wrap up rather. So briefly, we'll revisit those learning outcomes that we identified at the top of the presentation to check whether or not we've addressed them all. So outline how prescription extension builds on existing professional practice in terms of delivering person-centered care. We considered this in particular in terms of building on what you already do under Regulation 9 and ensuring continuity of care and access by patients to the medicines that you undertook during the pandemic. Discuss the regulatory requirements and guidance in place for prescription extension as addressed in the prescription extension decision-making tool. We looked at the 6-step process, which incorporates the various regulatory requirements together with relevant PSI guidance. And the post-extension follow-up care should a prescription be extended was also addressed. Describe the key features of shared decision-making. Aisling addressed how the HSE's 4 guiding questions from a shared decision-making tool skills card can be adapted to prescription extension. Recognise the key planning points for incorporating prescription extension into pharmacy practice. Claire identified a range of issues for you to consider and take account of when planning to incorporate prescription extension in your pharmacy. Outline resources available to support prescription extension. Claire also addressed these and highlighted their availability on the IOP website and other places, and identify any CPD learning needs. You're already on the way here. You identified the need to learn more about prescription extension by attending tonight. So perhaps with further reflection, you'll identify some allied additional learning needs. Dawn will speak further on this, but you've at least one reflective cycle in the making after. But most importantly, and just to summarize, we hope that you're leaving this webinar better informed about what is involved in prescription extension and more confident in taking it on than you were at the start of the webinar. As practicing pharmacists, you already have the knowledge, the skills, the competency to provide this service. No additional formal training is required to be completed by you. The toolkit with the 6-step decision-making tool is there to help you get started, guide you through those first patient conversations until you get up and running in the process to decide whether or not prescription extension is appropriate in any particular case for your patient or not. Finally, if any of you would like to learn a little bit more about prescription extension and join with others in collaboratively working through some of the sample case scenarios in the toolkit, then register for one of the forthcoming workshops planned on dates in September and October. But other than that, again, thank you very much for taking the time to join us this evening.
Super. So a big thank you to Matthew, Aisling and Claire. Fantastic presentation. And I'm delighted to say the questions are just flying in. If I could ask people, just as a reminder to, as opposed to raising your hand, just to put any questions and comments in the Q&A box so that we make sure that we can get to as many as we can. And just as a reminder to everybody, the Q&A will be captured tonight. I know the project team presenting tonight really value your feedback to help them feed forward even further into the workshops and the resource. So I think a number of themes that I can identify from the questions and answers. I just want to speak a little bit to the fact that some of the questions coming in are around some more operational issues, which is just not the scope for tonight. So again, they will be captured, but I just want to keep the focus on the resources and the decision-making tools. So we are mindful and we value that feedback. So I just want to note that. I think one of the questions is around locums, both locum GPs and locum pharmacists. So one question has come in about a GP who's going to be retiring and how they would feed back to the prescriber in that case. And similarly, if you're a locum pharmacist and you're not as familiar with the patients as you would be in your regular practice, how that can be managed. So just wonder if one of the panel would like to address that one, please.
I suppose in terms of the locum pharmacist, Sarah mentioned it's one of those things about setting up around staff training, but also having procedures in place in the pharmacy around that. And that would be one of the issues to consider if there's going to be, a locum in, whether or not, you want to have locums engaging in prescription extension or not. And similarly, if there's a number of pharmacists in the practice as well, that's discussions to have as to, is everybody going to do prescription extension and how is that going to be communicated within the team? I suppose in relation to a locum GP, I'm not quite so sure in terms of the question whether or not you would engage with them. Like obviously, if they're based in the practice, if you do extend a prescription, then you're obliged to notify the prescriber or a relevant primary care practitioner. So you would just notify the practice as in relation to that. I'm not sure if that's answering the question.
Sure. Yeah, it was just around the issue where you have a GP retiring from a practice and there's no replacement. But I think as you've highlighted, that would come down to what the service provision is going to be in that practice and how that's brought out at a local level. Would that be right?
Absolutely. So you will be informing the practice and that prescriptions have been extended if the prescription has issued from that practice. So
Brilliant.
Important.
Super. Thank you, Matthew. And if I could just address another theme that's coming through in terms of monitoring. So if, for example, it's a blood pressure medicine or if it's a medicine used to treat a diabetic patient, is there a requirement to undertake monitoring separate to the prescription, or part of the repeat, but a separate to the actual process, if you like, if I can separate them slightly in terms of the question? You'd like to take that one?
So I suppose, as I said in the presentation, I relate it back to what I would normally do in practice. So if you feel comfortable that taking a blood pressure or I don't know, a glucose level in the pharmacy, I don't know if that would cover it, but it's up to you with those individual patient circumstances what you feel comfortable with. There's no legal obligation to carry out any monitoring requirements as part of this prescription extension.
Yep. Thank you very much. That's brilliant, Claire. Thank you. There's a number, and I'm just trying to keep up with them here, but there's a number of questions coming on the specifics of repeats. But would I be right in thinking from the case studies that particular aspect covered off tonight will be looked at further in the workshops?
In terms of the number of is that in terms of the period that you extended for?
Exactly. So there's a few questions coming in around if the number of repeats aren't specified or if they're specified for specifically, for example, one of the questions 2 months or 1 month, etc. So you're getting differences in terms of repeats. And another question on the same theme is looking at or alludes to an S1B medicine where the number of repeats aren't specified or where it is specified to repeat, as required. So there's just a lot of questions coming on and specifics.
I think originally with the prescription at the very beginning when it's presented in the pharmacy, that probably issue would be clarified at the beginning in terms of is this for 6 months or is it for a lesser period than 6 months, or indeed if it's for a period beyond 6 months. So obviously if it's for a period of less than 6 months, then that prescription isn't eligible to be extended. Similarly, if it's for a period beyond 6 months, then it can be extended. So I think there are probably issues that are generally probably clarified at the beginning when the prescription is extended, first presented in the pharmacy that would probably be clarified at that point. So I think by the time you might get to the point of whether or not considering whether or not it's eligible or not in terms of is it a 6 month or not, would probably have been identified in advance of.
Super, thank you. I'm really conscious of time in terms of the number of questions. We have received phenomenal questions, which are fantastic, and I have no doubt they're going to feed in very positively into your workshops. So just conscious of getting any people go on time tonight. So if I may just put up one last slide in terms of the practicalities of where people can get further information on the actual resources themselves. So how do people actually access the resources and how do people register and attend the workshop? So you'll see at the top of this slide, where can I find the resources? There is a resource hub tab on the main IAOP webpage on the website. And if you scroll down to the bottom of that, you will see Expert Task Force Phase 1 recommendations. And within that, you will see the webinar for tonight, the decision-making tools, the workshops, the host of resources that you've alluded to, and also some IAOP supports as well to complement the suite of resources that you've developed. And second of all, in terms of questions addressing how you can attend a workshop or how you register for a workshop, this is behind your login. So once you click on the courses and events, which is here, this tab here, courses and events page, again on the main IAOP website. It will take you to all our courses and events, and you will click the sub-click here, or the section called Live and Blended Resources, and it will take you down to the extension workshops, of which there are 3. And once you click on enroll, you will be enrolled on the course. There's also the option to be added to a wait list. So if it's not possible to enroll right away, please do select the waiting list option. And just as a practical reminder, if you've enrolled on the course, on the workshop, and you're no longer able to attend, if we could just ask you to unenroll as well, just to free up the place. So I have no doubt they're going to be very, very popular in terms of what we've seen tonight, in terms of the questions and in terms of the content, and as a resource going forward. So I just want to, as a reminder to people who have attended tonight and all the registrants, I just want to remind people that we do have a post-webinar survey that will be sent in the follow-up email, with a copy of the slides and the recording, which will be made available after tonight. And we'd really encourage you to complete the survey. I know the project team are very keen to get your feedback, as I say, to even further feed into their workshops with all those fantastic questions. Hopefully you found the webinar really useful tonight. I know I have a lot of information, a lot to digest, and hopefully between the suite of resources and the webinar itself tonight, there's a lot of content to feed into your e-portfolio, as Matthew has alluded to earlier, your CPD cycles, and most importantly, to support your practice going forward. Our next webinar, the details of which will be communicated through the usual channels, through your email and our social media posts. So just as a little reminder, if I could ask people to make sure your email details are up to date, so you're getting all our communications, just with this being such an evolving space and a lot going on. So I just would really like to thank all our presenters, panelists tonight for their huge contribution. I'd also like to thank all the registrants and attendees who have come on here tonight, and the level of engagement has been huge, well, you'll see from the questions and answers and what we're feeding forward. So thank you, because without your feedback, it's difficult to keep continuing the resources and also to get the needs of the profession. So thank you. Thank you for those who have contributed to comments and questions tonight. That is invaluable for both us at IAOP and for the project team based in RCSI. So that just leads me to say a good night, enjoy the rest of your evening, and I'd like to bring the webinar to a close. Thank you.
Thanks, everyone. Good night.
Thank you.
Thank you.